Sexual diversity represents the variety of sexual orientations, identities, and expressions that individuals may experience. Understanding this diversity through a medical lens is crucial, considering it significantly impacts healthcare, societal attitudes, and overall quality of life for individuals. For decades, the medical community has been evolving in its approach to sexual diversity, shifting from stigmatization to a more inclusive perspective that recognizes the complexities of sexuality and its profound implications on health. Historically, medical perspectives on sexual diversity have often mirrored societal attitudes, which were frequently mired in prejudice and misunderstanding. Diseases predominantly associated with certain sexual practices were labeled as moral failings, leading to the stigmatization of entire groups. The medical community often pathologized sexual diversity, treating conditions such as homosexuality as deviant or pathological until very recently. However, as knowledge about human sexuality has progressed, the medical field has increasingly understood that sexual orientation and gender identity are not simply matters of preference but are integral aspects of an individual's identity. This shift began in earnest in the late 20th century, particularly with movements advocating for LGBTQ+ rights, which emphasized the need to destigmatize and understand diverse sexual orientations. Medical organizations began recognizing that non-heteronormative identities are not disorders requiring treatment but rather natural variations of human experience. Diagnostic criteria were altered, and elements of the American Psychiatric Association's DSM were revised to remove homosexuality as a mental illness by the 1970s. This pivotal change laid the groundwork for more accepting policies and practices in medical fields concerning sexual diversity. The discourse around sexual diversity in healthcare settings now emphasizes affirming identities, respecting autonomy, and providing culturally competent care. This means understanding the social determinants of health that affect sexual minorities. Individuals who identify as LGBTQ+ often face unique challenges, including discrimination, social stigma, and increased rates of mental health issues. These factors can lead to barriers in accessing health care, resulting in adverse outcomes. Therefore, medical practitioners must recognize these dynamics to provide effective and empathetic care. Mental health considerations in sexual diversity are particularly pressing. Studies have shown that LGBTQ+ individuals, especially youth, experience higher rates of anxiety, depression, and suicidal ideation compared to their heterosexual peers. This disparity can be attributed not only to the challenges faced within society but also to internalized stigma and minority stress. It is essential for mental health professionals to create safe environments for sexual and gender minorities, offering support that acknowledges the specific issues affecting these populations. Gender diversity, encompassing transgender and non-binary individuals, demands a nuanced understanding from healthcare providers. Gender-affirming care has gained prominence, focusing on treatments that align an individual's physical body with their gender identity. Comprehensive care includes access to hormone therapy, mental health support, and surgeries such as gender-affirming surgery. Medical professionals are encouraged to educate themselves on these matters to provide respectful and informed care. Another critical aspect of sexual diversity within medical perspectives is sexual health education. Comprehensive sexual health education that includes discussions on various sexual orientations and practices is vital for fostering understanding and reducing stigma. This education equips individuals with the knowledge they need to engage in healthier sexual practices and make informed decisions regarding their sexual health. Furthermore, it prepares medical professionals to approach sexual health assessments and discussions in an open and non-judgmental way. Access to sexual health services, including STI testing, contraception, and preventive care, is another area where sexual diversity plays a critical role. Individuals from diverse sexual orientations may have specific healthcare needs that differ from those of heterosexual individuals. For instance, men who have sex with men may have heightened risks for certain STIs, necessitating targeted screening and education. Tailoring services to meet the needs of diverse populations not only improves individual health outcomes but also contributes to overall public health. Chronic disease management in the context of sexual diversity is also an important consideration. Certain populations may have unique health risks associated with their sexual practices or identities. For example, individuals who identify as LGBTQ+ may face increased rates of substance use or certain mental health issues that exacerbate chronic conditions. Understanding these links enables healthcare providers to create more effective prevention and intervention strategies tailored to diverse populations. Recognizing the intersectionality of sexual diversity in healthcare is vital. Factors such as race, socioeconomic status, and disability all intersect with sexual orientation and gender identity, influencing health outcomes. For example, LGBTQ+ individuals from marginalized racial backgrounds may face compounded discrimination in healthcare settings, leading to even worse health outcomes. A nuanced, intersectional approach allows healthcare providers to understand and address these complexities more effectively. Moreover, the role of advocacy in promoting sexual diversity within healthcare cannot be overstated. Healthcare professionals can leverage their positions to advocate for policies that protect the rights of sexual minorities. This advocacy may include pushing for more inclusive health insurance policies, supporting anti-discrimination legislation, and fostering a culture that prioritizes equality and respect within healthcare settings. Physicians and healthcare providers must also engage in continual self-education regarding sexual diversity. Attending workshops, participating in training programs, and remaining informed on current research are essential practices for providers aiming to improve care for diverse populations. Such commitments promote not just better patient care but also help to challenge the biases that can permeate medical settings. The importance of representation within medical fields should also be noted. Having healthcare providers who identify as LGBTQ+ can significantly impact the quality of care and the willingness of patients to seek help. Representation fosters trust and helps to break down barriers that often deter sexual minorities from accessing healthcare services. In summary, understanding sexual diversity through medical perspectives is a multifaceted endeavor that requires ongoing education, advocacy, and an awareness of the unique challenges faced by diverse populations. The evolution from a pathologizing model to one that affirms and respects identities has created a foundation for more inclusive and effective health care. Nonetheless, there is still much work to be done to ensure that all individuals, regardless of their sexual orientation or gender identity, receive equitable, compassionate, and competent healthcare. By recognizing and addressing the complex interplay of sexuality, health, and societal factors, the medical community can foster an inclusive environment conducive to the overall well-being of all individuals. This journey not only enriches the lives of the patients but also strengthens the fabric of society as a whole, highlighting the profound importance of embracing and understanding sexual diversity. Sexual diversity has been a topic of discussion and debate across various religious perspectives, with each faith having its own unique stance and interpretation on the matter. In many religions, sexual diversity is seen as a natural part of human existence, while in others it is viewed as a deviation from the norm or a sin. The way religious perspectives view sexual diversity can have a significant impact on the lives of individuals who identify as lesbian, gay, bisexual, transgender, or queer, as well as on the broader societal attitudes towards sexual diversity. In Christianity, for example, there are a range of views on sexual diversity, with some denominations being more accepting and others being more conservative. Some Christian churches, such as the Episcopal Church and the Presbyterian Church, have officially recognized and affirmed the rights of LGBTQ individuals, including the right to marry and be ordained as clergy. Other churches, such as the Catholic Church and some evangelical denominations, have taken a more conservative stance, viewing homosexual acts as sinful and opposing same-sex marriage. In Islam, the views on sexual diversity are also complex and varied. While some Muslim-majority countries, such as Iran and Saudi Arabia, have laws that criminalize homosexual acts, other countries, such as Turkey and Indonesia, have more liberal attitudes towards sexual diversity. Some Islamic scholars and theologians have argued that the Quran and Hadith, the holy texts of Islam, do not explicitly condemn homosexual acts, and that the prohibition on homosexuality is based on cultural and historical interpretations rather than divine law. In Judaism, the views on sexual diversity are also diverse, with different branches of the faith having different attitudes towards LGBTQ individuals. Orthodox Judaism tends to be more conservative, viewing homosexual acts as prohibited by the Torah, while Reform and Conservative Judaism have taken a more liberal stance, recognizing and affirming the rights of LGBTQ individuals. Some Jewish scholars and theologians have argued that the Torah's prohibition on homosexual acts is based on a specific historical and cultural context, and that it does not apply to modern-day LGBTQ individuals. In Hinduism, the views on sexual diversity are also complex and varied. While some Hindu texts, such as the Rig Veda and the Mahabharata, contain references to same-sex love and desire, other texts, such as the Manusmriti, condemn homosexual acts as sinful. Some Hindu scholars and theologians have argued that the concept of third gender, or hijra, which is recognized in some Hindu traditions, provides a framework for understanding and accepting sexual diversity. However, other Hindus have taken a more conservative stance, viewing homosexual acts as contrary to the natural order and the principles of Dharma. In Buddhism, the views on sexual diversity are also varied, with different schools and traditions having different attitudes towards LGBTQ individuals. Some Buddhist texts, such as the Vinaya Pitaka, contain references to same-sex love and desire, while other texts, such as the Hiddharma, condemn homosexual acts as unwholesome. Some Buddhist scholars and theologians have argued that the concept of dependent origination, which is central to Buddhist philosophy, provides a framework for understanding and accepting sexual diversity. However, other Buddhists have taken a more conservative stance, viewing homosexual acts as contrary to the principles of karma and rebirth. In Sikhism, the views on sexual diversity are also complex and varied. While the Sikh scriptures, such as the Guru Granth Sahib, do not contain explicit references to homosexual acts, some Sikh scholars and theologians have argued that the principles of equality and justice, which are central to Sikhism, provide a framework for understanding and accepting sexual diversity. However, other Sikhs have taken a more conservative stance, viewing homosexual acts as contrary to the principles of natural law and the will of God. In many indigenous cultures and traditions, sexual diversity is viewed as a natural and normal part of human existence. In some Native American cultures, for example, individuals who are recognized as two-spirit, or having both male and female spirits, are viewed as having a special status and role in the community. Similarly, in some African cultures, individuals who are recognized as having a third gender, or being neither male nor female, are viewed as having a special status and role in the community. Despite these varied perspectives, many LGBTQ individuals have faced discrimination and persecution within their own faith communities. In some cases, this has led to a rejection of faith and spirituality, as LGBTQ individuals have felt that their faith community has rejected them. However, in other cases, LGBTQ individuals have found ways to reconcile their faith and their sexual identity, often by seeking out more accepting and inclusive faith communities. The impact of religious perspectives on sexual diversity can also be seen in the broader societal attitudes towards LGBTQ individuals. In many countries, religious leaders and institutions have played a significant role in shaping public opinion and policy on issues related to sexual diversity. In some cases, this has led to the passage of laws and policies that discriminate against LGBTQ individuals, such as laws that criminalize homosexual acts or deny same-sex couples the right to marry. However, in other cases, religious leaders and institutions have played a significant role in promoting greater understanding and acceptance of sexual diversity. In many countries, faith-based organizations and initiatives have worked to promote the rights and dignity of LGBTQ individuals, often by providing support and services to LGBTQ individuals and advocating for greater inclusion and acceptance within faith communities. In recent years, there has been a growing recognition of the importance of promoting greater understanding and acceptance of sexual diversity within faith communities. Many faith leaders and institutions have recognized that the exclusion and marginalization of LGBTQ individuals is not only harmful to the individuals themselves, but also to the broader faith community. By promoting greater understanding and acceptance of sexual diversity, faith leaders and institutions can help to create a more inclusive and compassionate environment for all individuals, regardless of their sexual identity or orientation. Ultimately, the promotion of greater understanding and acceptance of sexual diversity within faith communities will require a fundamental shift in the way that many people think about and understand human sexuality. It will require a recognition that sexual diversity is a natural and normal part of human existence, and that all individuals, regardless of their sexual identity or orientation, deserve to be treated with dignity and respect. It will also require a recognition that faith and spirituality are not incompatible with sexual diversity, and that many LGBTQ individuals are deeply committed to their faith and spiritual traditions. By promoting greater understanding and acceptance of sexual diversity, faith leaders and institutions can help to create a more just and compassionate world, where all individuals can live with dignity and respect. This will require a commitment to education and awareness raising, as well as a willingness to listen to and learn from the experiences of LGBTQ individuals. It will also require a recognition that the promotion of greater understanding and acceptance of sexual diversity is not only a moral imperative, but also a spiritual one, as it reflects the fundamental values of compassion, justice, and love that are at the heart of many faith traditions.